How would you rate your risk of heart disease? Turns out most patients don't really have a clue as to how high of risk they are. If you'd like to find out more, this video is definitely for you. Hello, I'm Dr. James Bogash, publisher of Modern Health Myths, and one of the issues that we have in society is that people are at risk because of the lifestyle choices that we make: lack of exercise, poor quality diet, stress levels, um, the chemical exposures. But people don't generally do anything about it, even if they know, if they, let's say they're diabetic, not exercising and eating donuts. I think largely this is because we don't really explain the risk to patients for what heart disease, cancer, whatever it may be. We think that either A, we're not at risk, or B, we think that the medications we're taking are going to save us, and nothing could be further from the truth. I've been to more than enough funerals where the loved ones are left saying, but all their numbers were good. But I've always said that your numbers aren't good unless they're controlled with lifestyle. If they are brought down by medication, you're living in a false sense of security. So this brings us back to this particular study that really illustrates just how disconnected people are from how at risk they think they are. And the people with the worst behaviors seem to underestimate their risk the greatest. So in that, researchers looked at almost 6,000 patients, or 5,900 patients, just short of that, and they looked at their lifetime risk score. It was a scoring factor or scoring tool used to determine how high of risk somebody is for heart disease. And to be qualified for the study, you had to have this particular visit, and you had to be rated at either a high or intermediate risk. In particular, the 46% were intermediate, 54% were considered high risk. So this is a group of people who are at intermediate or high risk of heart disease. So it's going to happen. It's just a matter of time. But when they asked the participants, where do you put your risk at? A huge chunk. So we're looking at 84% were what they called hypo perceivers. So they believed that their risk was less than what it actually was. Only 16% of these almost 6,000 people actually accurately guessed how much risk they had for heart disease. So in other words, everybody thought it wasn't going to happen to them. Unfortunately, sometimes the first sign of a heart attack is a fatal heart attack, or first sign of heart disease is a fatal heart attack. So we don't always get a second chance. Just to drive it home, when they looked at the people who had clearly defined risk factors, how much they underperceive their risk. So smokers, we know that smoking increases your risk of heart disease. They were 204% more likely to underperceive their risk. The people on cholesterol lowering medication were 121% lower, perceived the risk to be 100, or were 121% less likely to perceive their risk as being less than it was. Sedentary, so people who weren't exercising, 167%. The biggest number in this study is people who were taking medications. These people had a 350% risk or likelihood of underreporting their risk. In other words, these people clearly thought that the medications were lowering their risk for having a heart attack, when the reality is they were still at just a high risk as they ever were, and the medications did very little to actually change that end outcome. So what's the take-home story? Lifestyle changes are the only answer. If you don't think you're at risk, but you have some risk factors, guess what? It's time to reevaluate that, and you are at risk. It is way past time to start making these lifestyle changes that we know are going to lower our risk of heart attack. They're not that difficult to make. I've covered some of the 7 factors in other videos and other information I put up on there, but even simple changes make a huge difference in long-term outcomes. So as always, I will post the link to this particular study in the comment section, and make sure you like this video, share it with somebody who you think needs this information, and subscribe to the channel.